So just a brief, I would say, introduction on Dr. Sunil and the topic for the day on the webinar, which is purely on dialysis and travel. Why I would say dialysis patients can move around. That is obviously a goal that NephroPlus started with. And just to give a reference, Raushan Khatoon ma'am, we have Kamal, our founder, who has been on dialysis for about 26. The entire, I would say, reasons to start NephroPlus was when we looked at Kamal and the kind of energy that he carries, the way that he travels, the way that he maintains his lifestyle, his diet. It gives full freedom to every dialysis gets to experience that. A guest should not be constrained to, I would say, his hometown, but feel free to travel, visit places because dialysis and a good lifestyle maintenance gives you that option. So I will cut the long story short and give a quick round of introduction for our panel members here. Dr. Sunil um, is a highly skilled nephrologist and a transplant physician with extensive experience in managing complex renal cases. He has done his MBBS from Kempegowda Institute of Medical Sciences and his MD in General Medicine from JSS Medical College, DM in Nephrology from Institute of Nephrourology, Victoria Hospital campus. He has been contributing to medical field through his clinical expertise and has presented research findings at various national conferences. His areas of interest include renal transplants as well as CK dialysis management. Welcome, sir, to the panel. I would also want to give a quick, I would say, introduction to Raushan Khatoon ma'am, who has been, I would say, our guest for the last 3 years at NephroPlus AVBRH Center in Varda. Ma'am loves obviously to travel, and with NephroPlus on holiday dialysis, she has visited places like Srinagar, Bengaluru, and Bhubaneswar. So I will request, I would say, Dr. Sunil to give obviously his thoughts on the entire, I would say, webinar topic, and then later a one-on-one conversation with Raushan Khatoon ma'am and her experience on I would say utilizing the dialysis on travel. What has been her experience with NephroPlus? Please, sir.
Okay, good morning, everybody. I welcome all the guests and overall there on the webinar. It gives me a nice privilege to be a part of this webinar, and in fact, this is the first webinar which is being I'm a part of from the NephroPlus. And as I told, the topic itself is nice from center to coast. So it obviously, as we told, the dialysis paradigm itself has changed since last 2 to 3 decades. So the days were there when we had hardly few dialysis centers. Like if you go three decades back, patients used to travel many a miles to come to a dialysis center, get a dialysis done, and go back. But now things have gradually changed, especially since last 1 or 2 decades, where the quality of dialysis has improved, the quality of care has improved, and the machines, new machines have come up, especially online machines with the OCM monitors, machines with adequate clearances, and newer technologies have come up where patient is able to undergo a dialysis successfully without much of complications. So with this brief outline to the topic, what would like to tell is patient who are since in fact I work in a corporate setup, we get a lot of patients, like patients who are working, they need to attend a seminar or conference. Elderly patients who are retired, they need to travel to their hometowns or need to visit their grandchildren or need to visit their friends. They come to us asking for a dialysis at the outside centers, and lot of people, so especially tourists or people, since I work in a corporate hospital, there are international patients who have come on a tourism visa and they want to get dialysis done. With this aspect, what would I would like to tell is dialysis has come so far. Like patient whoever is there, they are able to successfully undergo the dialysis wherever they are there. But few things or few key points I would like to stress all the patients who are there who want to undergo dialysis at a basically a transient dialysis or outstation centers, whichever they are planning. So whenever you plan a dialysis, especially at outside or like outside center, plan yourself in advance, like at least 6 to 8 weeks in advance you plan. So where you are visiting, whether there is a dedicated dialysis center or a dedicated nephrologist or a dialysis manager, which is who is associated with the center. So make sure those details are available. And second thing is you convey your all the reports, lab reports, and ECG findings, or X-ray. So all your medical records to the center which you are traveling basically. So take example, if you are visiting Bangalore, make sure you identify a good center which is at the Bangalore, and the center should be near to your stay, like basically where you are staying. So see, for example, if you are staying in Bangalore for a period of 1 week, make sure the center is near to you, at least like it's around 20 to 30 minutes drive, not more than that. So that's most important thing. And make sure yourself you communicate to the dialysis center manager who is available there about all your medical records. And most of the times it so happens, since there will be in-house dialysis patients, you will be given either a slots in the evenings or like in the afternoon time. So you should be mentally prepared for that, because it so happens you might be undergoing a dialysis in the morning sessions. So when you go to a transient dialysis center or outside center where you are getting a dialysis, you will be forced to either take a second shift, like afternoon shift, or in the evening shift, the dialysis. So for that, you need to plan accordingly and make sure your medications are with you, so that whatever medications what you are taking regularly sufficient. Like if you are traveling for a period of 15 days, make sure you have the medications for at least 1 month with you, and all the medical records. And if you are any surgeries or any reports of recent or any illnesses of recent past, like 3 to 6 months, if you are admitted, make sure you carry the discharge summary. So these are the few important things what I would like to tell. And coming on to the dialysis point of view, if you are using a single use dialyzer or a multiple use dialyzer. So most of the centers in NephroPlus right now, they offer single use dialysis. So that won't be issue. But in case if you are undergoing a multi-use dialysis in your like home center, communicate to them. So they'll be better prepared for that. And in case if your serology status is positive, so make sure that's been communicated to the dialysis center, because most of the centers at NephroPlus, we accept seropositive cases, but there are few centers which may not accept the seropositive cases. So that needs to be informed. For any complications which you are witnessing during your dialysis, like hypotension or cannulation problems or any other problems which you are experiencing at your native center, needs to be communicated to the outside dialysis centers which are visiting. So these things should be brought to the notice of the center before you travel. So, and if possible, consult a nephrologist at the time of enrolling for dialysis at the outside center. If possible, fix up appointment with a nephrologist, discuss with him your plan. So, and always try to attend a drive-in before you travel. So it so happens most of the patient they'll be like positive by drive-in by at least half kg or a 1 kg or sometimes 2-3 kgs also. So with the positive weight of 2 to 3 kgs, if you are traveling, it becomes little bit risky. So make sure you attend your drive-in before you travel. So, and obviously your hemoglobin status, make sure the hemoglobin is in the near normal range between 11 to 12 grams, and blood pressure is adequately controlled, and your cardiac status has been thoroughly evaluated. So these things needs to be taken care before traveling. So if you are able to take care of all these things, so any patient anywhere can travel. In fact, here in Sparsh Hospital, R, we have a lot of patients they'll be outside Karnataka or outside India. They come to us. Right now in our center only, we have around 5 to 10 patients who are from other places are undergoing dialysis. But we have made sure these things have been taken care properly and patients are undergoing dialysis successfully. So this is in brief, I would like to tell about dialysis at the outside center.
Thank you so much, Dr. Sunil, for giving a brief overview of what needs to be taken into consideration when travel has been planned, and what are the precautions slash, I would say, guidelines that one needs to follow. Sir, your interaction with Roshan, I would say, ma'am, if we can do that, and then we can open the floor for questions. I see multiple hands that have been raised. I'll keep getting the questions from my team, and I'll share once we finish, I would say, our one-on-one with Roshan ma'am and her experience on taking dialysis, I would say, on travel, holiday dialysis with NephroPlus. Please, sir.
Okay, hi Raushan. Yeah, am I audible? Hi
Hello.
Raushan.
Yes,
Hi.
you're audible.
How are you doing?
Yeah, I'm doing fine.
Just share your insights on your experience with NephroPlus and how it's like traveling or holiday dialysis.
Yeah, definitely. Sir, when I started my dialysis 3 years back, it was like my world has been confined to around the four walls of the dialysis center. But gradually, I got to know about holiday dialysis, and it was a boon for me, definitely. I started traveling and like exploring new places, and it gave me confidence. Definitely, what NephroPlus has started as a holiday dialysis scheme, it is working wonders, no doubt about it. And we have to first contact the our center, and we have to contact our nephrologist also, and keep all our prescriptions and details, like as you said, we have to inform them about things. And finally we need to talk to our center, and we have to book sessions in advance wherever we are moving to. And personally, I had a very good experience at different centers, not only at my own center in Wardha, but I had been to Bengaluru, then Srinagar, as I said. So there also the same kind of quality dialysis was provided, and the care, especially the emotional bonding and the kind of care these people have shown, it is at par. I had a really great experience, I would say. And definitely I'm looking forward to traveling to many different places also. So it was really wonderful.
Roshan, did you face any challenges when you were in Bangalore or like any other place like Srinagar also had you traveled? Did you face any challenges?
Challenges as such, I felt like booking was extremely easy. There was no hassle as such. But the traveling time, especially a city like Bengaluru, okay, where we have to travel from one place to another. So I had to reach the place in advance, the center basically in advance. We have to start beforehand. We have to keep our medicines all ready, and our emergency contact. And the first thing I would like to say that we have to be very diet conscious when we are traveling. That is the basic thing, because usually when we are at our hometown, we are very careful about our diet. But when we go beyond the boundaries, we are very casual sometimes. So that we need to keep in mind. That was the major challenge. And the fluid intake, that is also a major challenge. Like we cannot gauge it, like what we are taking and what we are not. So fluid intake and the diet. So we have to be conscious about it. Rest, everything can be managed at the center. And if we are really into it, so we have to be careful. But once we follow the scheme and everything, it is wonders, I would say. It works wonders.
Was there a difference in dialysis therapy or like dialysis adequacy means? Did you feel any complications during dialysis, like compared to your center at Varada or Bangalore, Srinagar?
No,
Like,
no, everything was the same. Rather, I would say they treated me like a special guest, a VVIP, I would say. When I had been to a different center, it was all the same, the quality dialysis. Only the thing is that, as you said, sir, single-use dialyzer was used. So that I experienced. Everywhere they were giving like single-use dialyzer. No other challenges. I said I was treated as a VVIP person. A very good treatment was given. And in fact, I remember in Bengaluru when I had been, I was around half an hour late. The center personals called me personally that, Madam, you have not reached. You had booked a session with us. And they were very concerned about it. I liked it. Truly, I liked it a lot. I still remember it was a standalone center at Shanti Nagar in Bengaluru. So the center manager was Mr. Shoaib. I still remember him. He was very concerned about me. So that experience really matters.
definitely, definitely. As you told, like the point needs to be taken, especially if you're in the metro cities. So, as I tell most of my patients, make sure you stay somewhere near to the center, at
Yeah,
least
definitely.
so less than 5 kilometers. So you'll be able to reach within 20 to 30 minutes now. So that's always better because if it's very far, then the traveling time itself will be more. And as she told, like obviously the dietary component needs to be taken care because since we'll be in our hometown, it so happens we'll be able to
Exactly.
cook according to our own, like or
Yes,
like in home. But when you go outside, that privilege or that you'll not be able to get it. So
definitely.
dietary modifications needs to be very important when you are outside.
And with NephroPlus, sir, one more thing that I have experienced, like if we tell them that the place where we are going to stay in that particular town, or like Srinagar, I was there, and I told them that this is the place where I stay. And so they themselves locate the nearest center to your hangout. That is also a very good benefit that I can say. I like this also.
Definitely, as NephroPlus, we have also seen like if you take Bangalore only, there are more than 10 centers across
Yeah,
Bangalore. So, a city like Bangalore, So there are more than 10 centers. So if you call them in advance, as I told earlier, if you are prepare yourself 6 to 8 weeks earlier, so they'll be able to identify whichever center is near to your place of stay. So
Yes.
rather than the other way around, where you need to look into center and then book your hotel or room. So you
Yes,
can book
yes.
your hotel and room, then tell them like, I'm staying here, can you search me a center? So obviously they'll be
Nearest,
help you
yeah.
out.
Yes, sir.
Okay, then can you take up some questions? I think if there are
Yes. So I will open the floor. Amya, if you can allow, I would say the attendees to ask questions. So a couple of, I would say, things that came
definitely.
in the chat. There is one question that has come which says, what are my options for getting medical care if I become ill while traveling?
Can you repeat the question? I didn't get the question.
Yeah. So, sir, the question is, what are my options for getting medical care if I become ill while traveling?
That's the reason. See, obviously, what I would tell most of my patients is, see, depends. See, few patients, especially if they are on dialysis for quite some time, 3 or 6 months, they usually sense when they become volume overloaded, they'll become dyspneic and tachypneic. They can always carry a diuretic with them. So diuretic means furosemide or a torsemide. So if they feel they are feeling breathless or overloaded, they can take a tablet of diuretics when they are traveling. Second thing is they can carry a portable BP apparatus along with them when they're traveling, so they can check their BP on their own. See, for example, if the patient's blood pressure is high, they'll be having antihypertensives with them, so they can always take that antihypertensive. So these are the two complications which we commonly see if the patient is traveling. Either they become volume overloaded, or their blood pressures might go up. So if these two things are taken care, 90% of the times the patient's problem will be solved. In spite of these two problems being attended, if they continue to be sick, then it's better they consult the nearest hospital. See, if they are traveling, take for example, if they are traveling by train, so obviously they can get down in a nearest station and take a medical help. So if they are traveling in a car or if in the bus, so obviously they'll be able to get down at the nearest medical center like a primary healthcare center or a community hospital, take a primary, take a treatment and go down. And it so happens if you take Karnataka, since I am in Karnataka, so most of the taluk places now, right now, they have a dialysis center. So if you take any taluk, so a district roughly has around 4 to 6 taluks. So at any place, if they are traveling either by train or car, if they feel they are breathless or if their BP is higher, so they can visit a taluk hospital where they have dialysis facility and they can take a dialysis.
Well understood, sir. There is another question that says, what is the process for arranging holiday dialysis at a new center? So, yeah.
See, most of the time, see, new centers, it's better. Most of the centers right now, they have people's called person called dialysis manager. So obviously, if you are going to, if you are in a new place, like for example, take example, you want to travel to Mysore. So most of the hospitals, there will be a dialysis manager, and their numbers you can take it on the website. Or basically, if your primary nephrologist is there, he can take the number from the his fellow nephrologist at the Mysore, and then connect with the dialysis manager there. So obviously they'll be able to work out. This we do it on a routine basis, because it so happens, see, in Bangalore only we see a lot of the patients travel to their native places in holidays. For example, they need to visit their kids, or they need to visit their friends. So what I do usually is, my fellow nephrologist whoever is there, I talk to them and arrange the nearest dialysis center there. So that thing can be done. Here, the primary nephrologist is the key. So whoever nephrologist is there, so we can discuss with them initially, telling like, I need to travel to this place. And it so happens, we nephrologists as a group, we have ourselves association. See, for example, in Karnataka, we have something called as NAC, Nephrology Association of Karnataka. So in this association, we have the phone numbers of all the nephrologists in each district and each taluk. So we can always get in contact with the primary nephrologist and talk to them and fix up an appointment there. This we will do it on a routine basis. So the patient needs to talk to the primary nephrologist and get it done. That's all. And it same happens if the patient is traveling outside the state also. There is a nephrology association called ISN. Probably most of you are aware, I think. Indian Society of Nephrology. In that, we have doctors' phone numbers and a directory available, and which centers they visit. So obviously, patient can take their help. And as you people are aware, I think NephroPlus is spread all over. So all over India. So they can contact NephroPlus also. So they'll be able to arrange a dialysis session, I feel.
Absolutely, sir. Sir, there are three follow-up questions that have come. Any recommendation or any recommended medicines we need to have in our travel?
That's why, as I told, that diuretic, furosemide or a torsemide. We call it simple language Lasix, like Lasix. The tablet, let them carry it. That is one thing. Second thing is antihypertensives. So that calcium channel blocker called Amlong or a sympathomimetic called Arcamine. So these two important drugs they need to carry along with them. Third drug, if a patient has a cardiac illness or if he has underwent a angioplasty or if he is at a risk of developing a cardiac event, he can carry nitrates with them. So it's called isordine, like nitrates. If he develops a chest pain, he can place the tablet under his tongue, so that gives him a quick relief. So these three drugs he should always carry, I feel.
Sir, another question that has come up in the chat is how do we ensure access to safe food and water while traveling?
So that, see, this is a little bit tricky question because most of the patient ask me the same. So with respect to water, what I tell them is always try to take a bottled water which is branded, so better quality. So branded quality water, it's always better to take rather than taking it from a hotel or in from the some other place. It's always bottled water is always safe for them. That is first thing. Second thing is always make sure in case if they outside, if they need to eat food outside, let them prepare a fresh food, whichever hotel or restaurant they are visiting. Let them order a food which is freshly made. So that is one thing what I order. In case if they are not able to take fresh food, always the fruits or the vegetables. So especially fruits like apple and papaya, which are less in potassium, can be consumed. Apple and papaya, along with the fresh fruits, fresh vegetables like carrot or a cucumber, they can always consume. So these things usually I advise the patient. And if possible, now there are a lot of patients who carry the cooker along with them. They can carry a portable cooker along with them. They'll cook on their own during their travel until they reach the place. Now, once they reach the place, according to the hotel or the restaurant where they are staying, they'll ask them to prepare them accordingly. So these things I am right now suggesting to my most of my patients.
Understood, sir. Sir, another question that has come in is that should we increase dialysis frequency or shift to, I would say, daily dialysis while on travel?
That's why, see, I mentioned in my initial phase of the talk. So attaining dry weight is very important for patients who are traveling. Talk to your nephrologist. Make sure you are at the dry weight before you travel. Don't travel if you are not attending your dry weight. That's the reason as I told earlier also, plan your travel 6 to 8 weeks in advance so that it gives your nephrologist also, primary nephrologist, time also to attain your dry weight. So that once your dry weight is attained, obviously it depends upon your travel. See, if the travel is taking more than a day, the next day you can undergo dialysis. But it so happens if you are traveling within India, you can reach from any corner to any corner within a day if you travel by flight. If you are traveling in the train, then probably it might take 24 hours. In those instances, you can make sure, for example, if you have taken a dialysis on Monday, so you are traveling on Monday evening, so you reach a Tuesday evening. So you can take a early morning session dialysis Wednesday. So that I tell most of the patient, make sure as soon as you finish your travel, go undertake a dialysis rather than waiting. So this I'm suggesting. So I think patients who travel by road or train, they face this difficulty. As long as they're traveling in flight, I don't think it's much of a issue at all. So that, and whenever you travel, make sure you restrict your water intake. Don't consume excess water. And salt also, make sure the salt restricted diet you take it. So these two factors make you to attain less weight. And obviously, the food you consume, don't try to take food which is rich in potassium. So that these two factors will be able to make sure at least by 2 days you'll be able to push your dialysis.
Yeah. So another question that has come in, sir, is are there any restrictions on altitude, temperature, or any type of destination for dialysis patients?
See, especially if a patient has underlying chronic pulmonary disease like COPD, or if a patient has bronchial asthma, so that if the patient has a history of high altitude sickness, these patients should be a little bit careful because it might so happen once they reach at that levels, so their underlying pulmonary disease might get precipitated. Understood. No, this is one issue. So make sure you always consult your pulmonologist before you travel to a place where there is high altitude. And if possible, you can carry oxygen, portable oxygen cylinders along with you, so that in case if you become breathless, you can always take the oxygen support. It so happens if patient is traveling at a place where there is high altitude, rather than the volume, or it's the desaturation, like oxygen levels which are known to cause you sick. So that these three things, as I told, COPD, bronchial asthma, and high altitude sickness. If the patient does not have these three illness, he can freely travel to high altitude places. That should not be issue at all. But it's always better if you are traveling to high altitude places. Make sure you take a pulmonologist opinion before you travel. And nowadays, it so happens you can take your nebulizers along with you. So even if you go to places where the altitude is a little bit high, you can use the duoling and Budicort respules, so that will be able to give you a bronchodilation. What happens? It so happens, especially patients if they are going for high altitude. Obviously, these places the temperature is little bit on lower side compared to the normal temperature. So patient will have a tendency for a bronchospasm. So if they are able to carry these nebulizers along with them, they can undertake or undergo nebulization at this place at least twice a day or thrice a day, depending upon the severity. I don't think dialysis patients should have an issue in traveling to high altitude places, but if they have an underlying pulmonary disease or a lung condition, they should be they should consult a nephrologist, pulmonologist before traveling.
Sir, there is a little, I would say, question that is deviated. There is somebody who has asked a question that her husband has probably got cardiac arrest twice in the last 1.5 years. During, I would say, it's dialysis, and the sugar level actually goes down.
Mm.
We don't have any other possibilities to maintain sugar level instead of giving dextrin.
Mm.
So, and he's non, I would say, diabetic. So that is one question that has come up, sir.
See, there are two components here. One is like sugars being low, and he has had a cardiac event 2 times, I think. So, obviously, as I told earlier, patients with dialysis, they are at risk of having cardiac events anytime during dialysis. So, especially if a patient is elderly, diabetic, the risk doubles. So, these patients, if they had 2 events, obviously, you should consult a cardiologist and get an angiogram, because we might have a subclinical uh, coronary artery disease which might be getting precipitated during dialysis. It so happens during dialysis we'll be removing around 2.5 to 3 kgs water, or sometimes we end up removing 4 liters of water from the patient body. So during this time the patient might have hypotension, and once they have hypotension it can cause ischemia or like decreased blood flow to the coronary arteries. Like basically coronary arteries are arteries which supply the blood vessel. These are the blood vessels which supply the artery. So they supply the blood flow to the like blood to the heart. So once there is hypotension during dialysis, it can cause ischemia. So that could be the one factor. See, this patient might be having this precipitation of coronary artery disease during dialysis. So he needs to consult a cardiologist, and upon the cardiologist consultation, he can undergo angiogram to rule out the coronary artery disease. And sugars getting low, the reasons could be multiple. One thing is the patients might be on a oral hypoglycemic agent like tablets called glimepiride, like I said, which you would have taken the day before or on the day of dialysis, which can cause hypoglycemia. Second thing, you might be on insulin therapy, which can cause hypoglycemia during dialysis. So make sure these two factors are ruled out, insulin and the oral drugs. So we advise our dialysis patient not to take any oral drugs like oral hypoglycemic drugs or insulin on the day of dialysis. And third thing is with respect to food. Most of the patients, it so happens, they try to skip a breakfast or lunch during dialysis, so that they feel they'll develop hypotension or they become weaker. So that should not happen. Patients should always consume food before dialysis and come to the center. So if they are not consuming food, so chances are they might have hypoglycemia during dialysis. And fourth thing is most of the centers they have a dextrose can in the dialysis. There are few centers they might not have dextrose can in their dialysis can. So during that time, the patient might have hypoglycemia. So these four things need to be taken care. If these four things are taken care, then I don't think they'll have hypoglycemia during dialysis.
Sir, another question that has come in from Tushar. When a guest get dialysis and got hyper between sessions, what are the ways to manage that situation?
Hyperglycemia.
They have only mentioned hyper, sir.
See, hyper can be hypertension also,
Hypertension, yeah.
hyperglycemia also. See,
I think
hyper.
it's hypertension only, because otherwise it could have been hyperglycemia.
That's the reason. See, hypertension is a common occurrence during dialysis because it so happens there are few drugs which are being which are dialyzable, means they are removed during dialysis, like calcium channel blockers or beta blockers. So that what happens once these drugs at the start of dialysis, patient's blood pressures will be normal. Once at the end of dialysis, or especially at the end of 3 hours, they start developing this hypertension. So that, as I told, one could be the reason is the removal of the drugs, so that these drugs would have come out during dialysis. So obviously you need to supplement the drugs. The second thing is volume overload. See, few patients we see they consume food or otherwise they consume water during dialysis. That can cause a rise in blood pressures. So whenever the blood pressure goes up, what we can do is we can tell the patient to take a oral antihypertensive agent. So what we follow is we give a calcium channel blocker or a beta blocker during dialysis. But if the patient's potassium is not an issue, you can always give a AC inhibitor or a ARB to control the blood pressure.
Sir, I think we have one more question. Does change in HD machine brand affects clearance levels?
See, I think in NephroPlus, I think probably we are all using Fresenius machine. So Fresenius is a Germany made, and it's a standard machine which is being used by most of the nephrologists or most of the dialysis centers in India. Should not be issue at all. But what it at the end of the day, apart from Fresenius, we have Braun, Nipro, and there are some Indian made machines also. As nephrologists, rather than the machine, we take something into the account. There is something called as KT by V or a dialysis adequacy. So whichever machine which you do, patient should be able to get adequate dialysis. Means you should have dialysis without complications. At the end of dialysis, patient should be stable to walk around, and you should attain the adequate urea reduction ratio. We call something called as urea reduction ratio. If there is a urea reduction ratio of 65%, so for example, if the pre-dialysis urea was 100 and after the end of dialysis it's 35, means post-dialysis, then there is a good adequacy. The same way there is something called as KT by V, means K is the dialyzer urea clearance, T is the time on dialysis, V is the volume of the urea distribution. So if this ratio is more than 1.2, that indicates the patient is getting adequate dialysis. So that I don't think if there is adequate urea reduction ratio and if there's a good KT by V which is being attained, any machine should be a sound, because Fresenius is a standard brand which is there in India since many decades. And there is one more company called Braun that's also good. And Nipro is there, I think, from Japan, I think, that I have limited experience. But I am been using, or probably my patients are undergoing dialysis with this Fresenius machines for a long time. I think that machine is good enough, I think. And there are few Indian machines which have come up in 2-3 years. There are research articles or there are numerous studies telling like they are good enough also. But I have limited experience on those machines. All I can tell is my experience goes with Fresenius machine and it's standard machine.
Sir, I think there are a lot of people, so there are a lot of questions that are coming in. Are we allowed to do gym while on dialysis? This is
Yes,
another
yes.
question.
Obviously, patients can do exercise, not issue at all.
Yeah.
But I tell most of the patients to carry out mild to moderate exercise rather than heavy exercises, because what happens if they are stretching out too much or if they are doing heavy exercises, what happens? Few patients they develop something called as rhabdomyolysis. That means their muscles might break down and that can cause a rise in potassium rather than all. So that they can carry out a mild to moderate exercise rather than severe exercises. And 20-minute workout per day is sound enough for patients on dialysis, because few patients I see they want extra like workouts like 40 minutes, 1 hour and all. It might happen their potassium might be an issue, and they might get more dehydrated during the process. So if they are able to make sure of their hydration and if they are able to take care, a 20-minute workout per day or a 15-minute twice a day should be enough.
Understood. So there is a question that has come in from Samira Salim. During dialysis, most of the time feeling dizziness because of low sugar after a meal. Reasons, please.
Dizziness, as I told earlier, sugars being getting low, that is one thing. And the second thing could be whenever a patient eats food during dialysis, especially not before, during dialysis, what happens? The blood flow is directed towards the stomach, or we call it as splenic circulation. So what happens whenever the food goes into the stomach, since the food needs to be metabolized, the entire blood flow goes to the stomach. So during that time, what happens is the blood is diverted to the stomach, the blood flow to the brain and the other organs becomes less. So that time the patient will have hypotension and that can cause giddiness. So this is the common reason. That's the reason we tell patient not to consume, especially food which is rich in carbohydrates or protein during dialysis. They can take food which is like high fiber, low carbohydrate, but let them not take high carbohydrate and high protein because that needs to be metabolized quickly or it takes more time to metabolize. Then that time the entire blood circulation goes to the stomach or a splenic circulation. Then they develop hypotension and subsequently giddiness.
Sir, I think last question that is here is, sir, like migraine headaches, pains, any medicine, please refer.
Sir, you can see migraine. Usually, if a patient is getting dialysis, first we need to find out what is the factor which is precipitating migraine, because there are so many precipitating factors for migraine. Even sunlight can precipitate migraine. Lack of sleep can precipitate migraine. A chocolate drink or a chocolate can precipitate migraine. So patients will have some precipitating factors which needs to be seen or which needs to be identified to treat migraine. Once this has been taken care, we can give treatment for prophylaxis, not for treatment of migraine. We usually give for prophylaxis. There's a drug called as flunarizine or one more drug called as tryptamine, like amitriptyline, which can be taken for a 3 weeks period to prevent migraine attacks to be happening. Understood? No? So the drug is called as flunarizine. Brand name is Narzine, and second drug is tryptamine, amitriptyline. Either of these two drugs at night can be taken, and it comes as 10 mg. Both drugs can be taken at night for prophylaxis of migraine.
Sir, there is another two questions that have come in. Clotting tendency starts half an hour after starting dialysis of a patient. What are the reasons for this and what should be the treatment?
See, usually if the patient is clotting, obviously that means his blood is hyperviscous. So that usually these patients, they require some blood thinners. So that either the patient can be started on a monotherapy with aspirin, 75 mg. So if most of the patients with the monotherapy with aspirin will settle down. If it's not settling down, then we can add one more dual therapy, antiplatelet or a blood thinner. It's called clopidogrel. So both can be given at a dose of 75 mg each. In spite of this, if the patient is having clotting tendency, then we can double the dose. Like, and we can make ecosprin 150 mg, clopidogrel 75 mg, and give the patient. And in spite of this, if we has tendency to clot, we can increase the dose of heparin. So this can be done. After all these factors, if the tendency to clot is more, then the assessment of the fistula can be done. Sometimes it so happens the fistula might be thrombosed or it might have stenosis at the site of anastomosis that can cause clotting tendencies. So these things should be taken care.
Sir, there is a question that has come. My father is doing dialysis since 2 years. He has not gained weight. How to increase his weight?
See, most of the patients during dialysis, on an average, they lose around each session of dialysis, they lose around 15 to 20 grams of protein. So, normal dietary intake for all of us, normal individuals, is 1 gram per kg body weight of protein per day. If somebody is 60 kg, he needs to take 60 grams protein per day. But if patient is on dialysis, as I told earlier, they lose 20 grams of protein on average 15 to 20 on dialysis. So you need to increase the protein intake. So if somebody is 60 kg, you can't, a patient will not be, it's not enough to give 60 grams. So you should give 1.2 gram per kg body weight. It means you should take somewhere around 72 to 80 grams protein per day. So most of the times it so happens these patients will be taking less protein. That's the reason they'll not be gaining weight. So first is dietary intake. Second thing is these patients they'll be on twice weekly dialysis. We see so that once they are on twice weekly dialysis, the adequacy will not be attained. So these patients needs to be switched over on thrice weekly dialysis. So there will be enough adequate creatinine clearance. Once there is adequate creatinine clearance, their appetite improves and they'll be able to eat the food. So third thing is most of the patients with the dialysis they have peptic ulcer or like a gastric or a duodenal ulcer because dialysis itself is a process where there will be chronic inflammation. So and these patients they'll be on drugs like antihypertensives, antiplatelet agents and all. So that they'll have some form of gastritis and few patients also have gastric ulcer or duodenal ulcer. So these patients should be put on a month course of gastric medications like peptic ulcer medications, so the acid suppression completely happens. So once this happens, then probably this hepatitis will improve. So these three factors needs to be taken care, as I told earlier. So once you are able to take care of these three factors, patient's weight will gradually improve.
Brijesh, if you can unmute yourself and you can ask your question. Dr. Brijesh, can you hear us? Not sure we are able to connect with him. Dr. Brijesh, you need to just unmute yourself and ask the question. Please unmute.
Meantime, we can take up some other questions if there.
Sir, there is another question that has come up. Why does we feel a vomiting sensation when we not eat regular intervals?
It so happens, as I told earlier, dialysis during dialysis there will be not enough clearance of all toxins in the dialysis dialyzer. So that's why in our center we do something called as high flux dialysis. The conventional dialysis or whatever dialysis what we do at our center, we usually do with the low flux dialyzer. These dialyzers usually clear small molecules, small molecular weight molecules, or some middle molecular weight molecules from the blood. So, especially patients who are not able to clear middle or high molecular weight toxins from the blood, these toxins get secreted into the gut because they'll be in the blood. They will not be cleared by the dialysis, so they get secreted into the gut. Gut means stomach or intestine. So once they are into the gut, patients have this tendency not to feel appetite at all. Even if they feel like eating the food, but as soon as they see the food, they feel nausea or vomiting sensation. So these sort of patients, what I do tell them is to switch over to high flux dialyzer or do a hemodiafiltration. So there is adequate clearance of the toxin, and once there is adequate clearance, especially if you are doing a hemodiafiltration or a high flux dialysis, there will be clearance of higher molecular weight toxins also. So once these toxins get cleared, so patient's appetite will improve and overall well-being also will improve.
Sir, one more question. Urine output is equal to input. There is no fluid gain in dialysis. Can we reduce the frequency of dialysis session?
See, as long as your creatinine is holding on, or if there is adequate urea reduction ratio with twice weekly dialysis, I think they can do a twice weekly dialysis. So standard, like international standard or what conventionally what we tell is thrice weekly dialysis is recommended. It so happens few patients they'll have good urine output as you told, so they'll be able to pass around 500 or 1 liter per day of urine. So in these patients, we need to look into creatinine. If creatinine is holding on, if it's around 5 milligram per deciliter, and if the patient does not have uremic symptoms, yes, we can do a twice weekly dialysis. And if potassium is holding on, so that potassium is within normal limits, like normal limits of 3.5 to 5.5 milliequivalents. With twice weekly dialysis, he can switch on to twice weekly dialysis. And if the patient is not having any uremic toxicity, like uremic encephalopathy, uremic neuropathy, or uremic gastritis, so these patients can be considered twice weekly dialysis.
Sir, another question that has come up is what can we do for hair fall for dialysis patients?
See, as I told earlier also, as the duration of dialysis prolongs, so that slowly the complications are going to go up, because it so happens some high molecular weight toxins or middle molecular weight toxins like beta-2 microglobulin, they are not cleared by dialysis. So like that, so many other toxins are not cleared by dialysis. So that, and obviously for few patients, dialysis itself is a stressful procedure, and there are a lot of social economic factors also which would play a role at all. During this period of stress, they have tendency to have a hair fall. So what I suggest most of the patient is take adequate sessions of dialysis, twice weekly dialysis. So there will be adequate clearance of toxin. Second, make sure you sleep well. So once you have a sound sleep of 6 to 8 hours, the stress levels will come down, then the air fall problems or air growth will be better. Third thing is add nutrients, especially zinc into your diet. So zinc is a very important nutrient for air growth. So if there is a zinc deficiency, obviously air fall will be more. So fourth thing is you can always add zinc to your supplements, like tablets, whatever you are taking, you can take zinc along with it, so the hair growth happens. So and we have some oil for hair growth, so which are like along with the essential fatty acids which are available, that we can prescribe for the patient, so they'll be able to attain the hair growth. So these five factors, if they are able to follow properly, hair fall won't be a problem at all.
Another question, sir. My urea is 37, creatinine is 7. Why does creatinine increase even though my urea is under control?
See, what happens basically as kidney functions, urea is basically absorbed in the tubules and creatinine is secreted into the tubules, means into the kidneys. And during dialysis, urea reduction is faster compared to creatinine. And creatinine is basically dependent upon the protein intake. Obviously, this patient's protein intake will be on higher side. That's the reason he's getting adequate urea clearance. Since he's taking a high protein diet or he'll be on protein supplements, the creatinine is on higher side. So at 7 creatinine is it's okay, it's normal only if a patient is undergoing thrice weekly dialysis, as long as his urea reduction ratio is attained. So if there is a urea reduction ratio of 65%, creatinine should not be a worry, I feel, in this patient.
Uh, Sir, I think rest of the questions are a bit repetitive, which you have already answered during, I would say, your conversation. Um, uh, any final, I would say, comments, sir, from your side on the closing, I would say, of the webinar? And something from Roshan ma'am, you can also mention as a closing comment from your side, as I would say, a patient undergoing dialysis and who have taken, I would say, holiday dialysis with NephroPlus. Anything that you would like to say?
With respect to the today's topic, I would like to summarize with 3-4 points. First is if you are trying to get a transit dialysis or home like holiday dialysis, make sure you prepare in advance 6 to 8 weeks. So that is most important thing. Second thing is if you are undergoing twice weekly dialysis, make sure you switch it over to thrice weekly dialysis and attain the dry weight. And third thing is make sure you carry all your medications, medical records, and history of hospitalization recently. So you once you go to a center, you'll be able to communicate to the dialysis manager. And if possible, meet your primary nephrologist at your own place and let him talk to the nephrologist at the place where you are traveling. So it's always better if a nephrologist communicates to other nephrologist who is there in the other center, because this nephrologist who is a primary nephrologist would have seen you over a period of years, so he'll be knowing about your problems, your complications, or your adequacy during dialysis. He'll be able to communicate to the nephrologist who is at the other center. So these four things needs to be taken care when you're traveling. And with respect to in dialysis as a whole, so I urge all patients to undergo thrice weekly dialysis as far as possible, because the days are gone where you are undergoing twice weekly dialysis, because the survival outcomes and the complications are less with thrice weekly dialysis rather than twice weekly dialysis. So then most of the centers now have switched over to single use dialysis. The outcomes are always better compared to single use dialysis rather than multiple use dialysis. And third thing is make sure whenever there is a problem, you consult the nephrologist. Nephrologist is not available. Dialysis managers are available in the centers. Communicate your problems with them, because it's so happening in India in last 1 decade. The dialysis outcomes are better and the dialysis survival is improved. On an average, we see around survival of 3 to 5 years a decade back. Now slowly the survival is improving. Any dialysis patient, he can have a life accordingly, like as an average to a normal individual who is there along with him, so that he can carry out his all routine activities and all the activities which can be carried out by other patient. So I urge all the dialysis patient to switch on to thrice weekly dialysis and have a regular follow-up with the nephrologist. Thank you.
Thank you so much, Dr. Sunil. Any closing comments from you, ma'am? Roshan?
Yes, I would like to say that basically your holiday dialysis at first may seem really scary for you, but once you take your holiday dialysis, you will feel that why did I wait for so long? So definitely we are more than just dialysis patients. We are, of course, warriors, I would say. We are dreamers, we are warriors, we are travelers. So I would request and I would rather urge everyone to just start traveling and exploring new things. Definitely, it would be a change of mind, change of atmosphere, and the monotonous life which we lead. It will have a tremendous experience, I bet. And definitely, I recommend it to everyone. And I would also give you heartfelt wishes for your not only your journey, but also your dialysis journey. Thank you.
Ma'am, thank you so much for those encouraging words, and thanking once again Dr. Sunil for sparing time and attending and leading this webinar. I hope that there's a lot of inspiration that we derive from Dr. Sunil's comments on how and the guidelines that we need to follow during travel for taking holiday dialysis, and a request from, and I would say an encouraging words from Roshan ma'am. So let's take that as an inspiration for all the attendees and for all the units wherein there are a lot of guests who have listened to this webinar. That dialysis doesn't restrict, I would say, you to be based you out of your hometown. If you are following, I would say, best practices on your meals, diets, medication, you can roam around, you can travel the world freely. So please adopt that as a practice and stay healthy. And thank you so much, Dr. Sunil and Roshan ma'am, once again for attending this webinar. Thank you so much. And thanks to all our guests and the audience who have joined in today. Right. Thank you, ma'am. Ma'am, we can drop, ma'am. Yeah.